Hello ladies and gentlemen, and welcome to the historical evolutions of anesthesia. Today, we as anesthesiologists can boast of a safe anesthesia practice thanks to the great stalwarts and inventors of anesthesia. But before 1846, it was not so. Non-drug methods were used like hypnosis, mesmerization, hitting on the jaw with a hammer, hitting on the head to make a person unconscious, bloodletting, nerve compression, so on and so forth. Oh, how dreadful! So, ladies and gentlemen, join me as I take you through the history of anesthesia. History of anesthesia dates back to 348 BC, when Plato, a Greek philosopher, first described absence of feeling. But it was much later that it was employed in oral and rectal preparations. In India, the pre-ether era begins with Sushruta in 500 BC, when surgeries were performed using wine, opium, Indian hemp, and of course, tying up. In 527 AD, in the Bhoj Pravandhini, it has been mentioned that Raja Bhoj underwent cranial surgeries using Sammohini for induction and Sanjeevani for recovery. The history of inhalation anesthesia dates back to 1773 to 1804, when Joseph Priestley first discovered carbon dioxide. Lavoisier heated mercuric oxide to produce oxygen. And again, the credit of nitric air goes to Joseph Priestley. However, it was Humphrey Davy who first produced nitrous oxide and advocated its use for dental extraction. He named it the laughing gas. The ether controversy, and there were 4 feuding physicians fighting to be given the credit for the discovery of anesthesia: Crawford Long, Horace Wells, Charles Jackson, and of course W.T.G. Morton. You will be surprised that ether was administered for the first time in 1842, when William Clark used it for his lady friend Miss Hobby for her dental extraction. Later in the year, an MD from Georgia, Crawford Long, first used it for tumor extractions of the neck and successfully used ether. However, both William Clark and Crawford Long could not publish their discovery and hence were never given the credit for the discovery of anesthesia. Hence the importance of publications, my dear friends. However, it is beyond the scope of this small video to complete this vast history of anesthesia, and so we have taken only a few excerpts from anesthesia and have tried to imagine what might have happened during that time. So, ladies and gentlemen, come join me and let us enjoy this beautiful video on the history of anesthesia.
I mounted on the bed and a cambric handkerchief was placed upon my face. My bed was surrounded by 7 men and my nurse. Oh, when the dreadful knife was plunged into my breast, I began a scream that lasted unintermittently during the whole time. The trauma of surgery lasted. So excruciating was the agony. Hello, you must be wondering, who am I? I am Fanny Burney, and this was my experience during my mastectomy. Imagine, even after being a celebrity novelist of the 19th century, I had to suffer such agony. A shudder runs down my spine even when I think of it.
Horace Wells, from 1815 to 1848, was the eldest child of a landowner born in Heartland in USA. He had an excellent basic education until he was 19 and had an active and inventive mind. He studied dentistry in Boston. He wanted painless tooth extraction and so had considered the possibility of nitrous oxide or ether for the relief of surgical pain. In December 1844, at the Union Hall in Hartford, Horace Wells and his wife Elizabeth attended a demonstration of laughing gas, nitrous oxide, put on by the showman Sir Gardner Quincy Colton. So now let us go and watch what Elizabeth has to say to her husband Horace.
Horace! Horace, darling, where are you?
In a moment, dear.
Darling, are you going for the exhibition in Connecticut today?
Oh, yes, I'm going.
Oh, please take me along. I pray to thee. I want to see the grand exhibition.
Well, okay, if you insist.
So friends, even I can't wait to attend the grand exhibition in Hartford, Connecticut on 10th December 1844, where Horace Wells was influenced by Gardner Quincy Colton, who showed successful painless tooth extraction. So let us go to the exhibition in Connecticut. Sir Gardner Quincy Colton is describing that a young man, Samuel Cooley, a shop assistant, under the influence of nitrous oxide, bruised his leg badly and was astonished to find his leg bleeding, as he felt no pain at all.
Sir,
Yes, please.
are you saying this gas makes a person pain-free? What is it called?
Yes, of course. The gas makes the person pain-free. It is called nitrous oxide.
Can you show me how it helps in tooth extraction? Is there no pain at all?
Yes, sure, sir. You inhale the gas from this bag and there is no pain.
I don't believe. Can you demonstrate? I would like to try it on myself.
Horace, are you sure? You want to try it on yourself?
Yes, I am.
You want to see? All right. Please be seated. You inhale the gas from this bag. Come on, go on. Take a deep breath. Again. Go on, come on. Can you help me? Gentlemen,
Horace.
how do you feel?
Is it done already? There was no pain. It's amazing. Great discovery. Can you please teach me to manufacture this gas, nitrous oxide?
Yes, sure, sir. My pleasure.
Thank you.
After this successful demonstration, Colton taught Horace Wells how to make the gas. Horace Wells used nitrous oxide successfully on 12 to 15 patients before announcing his discovery. He was invited to Boston by surgeon John Colin Warrens to demonstrate the effect of nitrous oxide.
Good morning, gentlemen. My name is Horace Wells, and I'm here to demonstrate painless tooth extraction. Yes, anyone from the audience, someone from the students who can come up here as a volunteer? Please, gentlemen.
Sir, my wisdom tooth is creating a lot of problem for me. Will you please help me to extract it painlessly?
Sure. Please, please have a seat. Sit here. Please. Inhale this wonderful gaseous mixture and there will be no pain. It gives a feel-good sensation. It's a laughing gas, you see. You will feel tickly and there will be no pain.
Thank you very much, sir. I will be really grateful to you. Should I inhale from this bag?
Please. Please go ahead. Please, keep breathing, keep breathing. Laughing. Keep taking deep breaths. Keep taking deep breaths. That's good. Gentlemen, please. Keep taking deep breaths. There you are. Now you can extract his tooth painlessly.
There is no pain relief.
He's a fraud. He's a liar.
This is not good.
He is a humbug.
Horace Wells felt humiliated and went out fuming with rage. So friends, unfortunately for Horace Wells, his public demonstration had failed and he was termed a humbug. Later it was found that the gas nitrous oxide was not effective in obese and alcoholic individuals. Horace Wells became addicted to chloroform and later committed suicide. Oh, what an unfortunate end to this great discoverer of anesthesia.
Hello, ladies and gentlemen. I'm William Thomas Green Martin. Call me WTG. They call me with lot of respect, father of modern anesthesia. Oh, but believe me, in my earlier days, I had to struggle a lot. Let me narrate my story. I was born in Charlton, in Worcester County, Massachusetts, in America in 1819. I was a dental student in the College of Dentistry, Baltimore. I was a dentist by profession, but totally frustrated by the way patients yelled at me. It was blood curling, and it used to get to my nerves. I tried olive cloves, I tried camphor, I tried whiskey, I tried brandy, all in vain. I was desperately looking for something to numb nerve. Then I came to know about Horace using some gas for tooth extraction. I was his pupil and latter partner, so I went to him. And then I came to know about sulfuric ether. Very unfortunately, I had no one to experiment upon. So I inhaled myself. And my wife found me lying unconscious on the floor. And what she thought? She thought I was drunk. Ladies and gentlemen, this gas lithium, yes, lithium, as I patented it, is a wonderful gas. It made all my patients pain-free and my own life very easy. Very soon I become rich and famous. I was invited by surgeon, Sir John Collins Warren from Massachusetts. So ladies and gentlemen, let me take you to the Bullfinch building of Massachusetts General Hospital, Boston, to witness history.
Hello, I am Dr. John Colin Warren, the surgeon at Massachusetts General Hospital. Today, I have a patient with a vascular tumor at the side of his neck, which needs to be removed. But I wonder, can we do it without causing any pain to the patient? Be seated, please. How are you doing today?
Sir, I'm scared beyond wits about the procedure. Will it pain? Will I survive?
Of course you will. You will feel no pain. Dr. Martin is coming here today with his gas called lithium. He has used it successfully to alleviate the pain of the surgery. Dr. Henry Bigelow has himself witnessed it. So do not worry. You will be fine. I presume Morton is engaged otherwise. I'll proceed without him. Oh, Morton.
Oh, hello.
Here you come. Your patient is ready.
Thank you, sir. Sir, do not worry. You will have no pain. All you have to do is to inhale this gas. Oh yes, the smell is pungent, but after some time you will have no feeling of it. Keep breathing. Breathe easy. Sir, your patient is ready.
Is he?
Yes, sure.
Oh, good. Gentlemen, this is no humbug.
I am Gilbert Abbott. I'm a journalist and a printer. I would like to share my experience about the surgery you witnessed.
I did not feel pain any time during the surgery.
Though I was aware of the procedure going on. The knife felt like a blunt instrument across my neck. This gas, I tell you, is boon to all the patients.
So, ladies and gentlemen, man conquered pain on 16th October 1846, a memorable day in the history of anesthesia. Who can forget Queen Victoria, the Queen of United Kingdom of Great Britain, who reigned for 64 long years, the second longest in the history of Great Britain. Queen Victoria, as a woman in medical history, bore pain very badly. She gave birth to 9 children from 1840 to 1857. But even after 7 royal births, she was anything but enthusiastic for her 8th delivery in 1853. Dr. John Snow administered chloroform anesthesia on a handkerchief, and she gave birth to Prince Leopold on 7th April 1853. So friends, let us visit the Buckingham Palace and listen to what the Queen has to say about her experiences with chloroform anesthesia.
Oh, the birth of Prince Leopold was a memorable experience. I had called Dr. Snow for my delivery. After the birth of my 7 children, I was mortified with the thought of going through the labor pains once again. But at 20 minutes past 12, the doctor commenced, giving me a strong smelling pungent gas with each labor pain. It gave me a great relief from pain with each application. Oh, the blessed chloroform that Dr. Snow gave me had a soothing, quietening effect, and it was delightful beyond measure.
There have been many great anesthesiologists since then, before whom surgery was an agony. Hope you have liked this video. And now to introduce you my beautiful team without whom I couldn't have made this video. Here is my team.